Good morning and welcome. Now, are you sure that you're in the right place? Right? You chose to click on a video about the metaphysics of morals. Well, good. I'm glad you're here. You can nerd out with me for a few minutes and share in my love of ethics. Let's get to it. So why pick this topic from a German philosopher from the 18th century who argues that morality comes from logic and from reason? Well, for one, Immanuel Kant is not mainstream modern ethics. And so the value here is getting to hear a very different perspective that I hope will challenge you in a good way. And you may be surprised with what you find. Second, even though Kant may not be mainstream, he still has had some impact on medical ethics and on the field of palliative care. And I want to point those areas out. So we'll touch on a whole list of interesting ethical topics today. And lastly, I hope to show you that even if you don't agree with everything he says, I certainly don't, you likely have some common ground with Kant, and that makes it worthwhile to understand where that comes from. Nothing is a substitute for reading original work, and this is a tiny taste of something that is really dense. So if you like the little morsel that is this video, and if you want to learn more, seek out the original text. In the comments section, I have a link to a public domain recording of this book. So if you prefer to have it read to you, that could be done. And here is how we'll keep some organization to our lecture. We'll start by defining what is good and what is moral, at least according to Immanuel Kant. And where does morality come from? What are the rules? How do emotions factor in? And lastly, to talk about a very, very different interpretation of autonomy that's probably a lot more appetizing to most healthcare professionals. So what is good, according to Immanuel Kant? Kant believed that our goodwill is the only thing that is always good, the only thing that is unconditionally good. Certainly people can have other qualities that can be good, but those can also be corrupted. Take, for example, intelligence or strength or wealth or wisdom, even Aristotle's virtues like courage. These can be used for good, but can be used for other motives if the will of the person is not good. We'd all agree that a serial killer isn't moral, even if he is intelligent or strong or courageous in his tactics. Acting out of goodwill refers to a person's motive. And so Kant's theory focuses on intention, not the outcome, which is a major contrast from some of the other moral theories like utilitarianism. And Kant believed that we should act out of goodwill because it is our duty to do so. Our motive should be this obligation towards duty, not doing what's right because of empathy, not doing what's right because of kindness, not doing what's right out of a pursuit of happiness, as Aristotle proposes. Certainly not a very warm or inviting or romantic theory, is it? So let's take a look at an example before we move on. When you think back to your time as a student, we all encountered a variety of teachers. Some teach for pleasure. Perhaps they enjoy the art of teaching or helping others, the main motive here being personal happiness or fulfillment. Some teachers have an inferiority complex and they ruthlessly pimp their students in rounds. And as a result, sure, those students study hard, they learn a lot out of fear, and fear can be an effective teacher sometimes. Some teachers educate for more pragmatic reasons, like maintaining a position or a title or income. But none of these examples would be deserving of praise, according to Kant, except this final one, that we teach our students out of a sense of duty to educate, and that we approach this duty from a place of our goodwill to do the right thing, regardless if it brings us happiness or benefit or a title. Where does morality come from? Kant believed that morality comes from within us, and that we derive it from our ability to reason. He didn't think that it could come from any other outside source, not from experience, not from religion, not from divine command. And he believed knowing what is right is something that we all can understand and all can logically work out. And this leads to some interesting implications. For one, a common thread about all humanity is our shared ability to think and to reason. So it doesn't matter where you live or what era you're from, what religion, what culture you're a part of, we all have the same potential for morality within us because of our ability to reason. Second, a universal source of morality means every single human being is deserving of dignity and our respect. And we'll see how important that is to Kant. And third, this puts the utmost importance on our autonomy. Each of us wields the ability to legislate what is right and what is wrong. So let's look at an example of how this has impacted our code of ethic. Here we have the ANA Code of Ethic for nurses. If you've never read this, I recommend you pause here and do so. When you read this, it's easier to see other philosophers' impact. For example, Aristotle's virtues are clearly present. There are 5 here that society and the nursing profession believe are the most important to a nurse: wisdom, kindness, truthfulness, justice, and bravery. To find Kant's input, we read provision 4. The nurse has authority, accountability, and responsibility for nursing practice, makes decisions and takes action consistent with the obligation to provide optimal patient care. It doesn't say a good nurse follows physician orders or a good nurse blindly follows hospital policies. Instead, a good nurse should do what's right because they have the authority, the autonomy to understand what is right, and even stand up to others, including physicians who may be acting contrary to that. That is Kantian. The source of right and wrong comes from within as the utmost authority. Here's another example. This is the AMA Code of Ethic for physicians. If you've never read it, please pause here, take a moment to do so. Interesting that we see the exact same 5 virtues from Aristotle: wisdom, kindness, truthfulness, justice, and bravery, even though they're written slightly different. To find Kant, we read subsection 3. A physician shall respect the law and also recognize a responsibility to seek changes in those requirements, which are contrary to the best interest of the patient. Again, a similar theme, that it's our duty to not just blindly follow the rules, but to reach our own conclusions with our own moral authority, and then to help enact changes to match those conclusions. So what are the specific rules? Here is where I think the real beauty and humanity of Kant can be seen. To answer this, Kant describes something called the categorical imperative, or said another way, the rule you ought to follow if you want to be moral. And Kant worded his categorical imperative in several different ways, even though they're all getting at the same point. And I'm only going to touch on 2 of those. My favorite is this first one, the formula of humanity. Paraphrasing, it says, we should treat everyone as an end instead of a means. Or put another way, everyone's life has dignity and worth that demands respect because of their ability to reason. And this is why we don't treat people as a tool to get what we want, which would take away their autonomy. Kant didn't believe that there should be any room for exceptions to these imperatives, no matter how much hypothetical greater good. You still treat each person with respect. We see this formula being challenged in the world of medical research. A good example of a failure of thinking like this here within the US was the Tuskegee syphilis study, where participants were used as a means or tools towards research objectives without consent. And if you resonate with this formula of humanity, then you share a Kantian perspective. Another is the formula of universal law. It's paraphrased as, before you do something, ask yourself if this is something that you would want everyone else in the whole world to do as well. These are challenging to put into day-to-day application, but I do think that there is a lot of beauty in these two concepts. Should emotions be part of moral decision-making? I suspect that by now you already know Kant's answer. Would someone who believes in pure rational reason allow emotions to interfere with that reason? Well, no. Kant was not a fan of emotion immorality. And we in the field of palliative care appreciate all too well the struggle that reason and emotion have in a very difficult decision making. I mean, there are entire texts on this, and one of my favorites is this one here from 2009. And much of it is dedicated to distinguishing between the cognitive data and the emotional data being presented to us by patients. Emotions and reason are both real factors in patient decision making. So even if Kant believes emotions should not be part of this process, the reality is that they are. And a big part of our role is influenced by this Kantian perspective because we help identify when those emotions have become barriers to decision making, and we help to try to alleviate those emotional barriers when they're present. Consider the patient who receives a diagnosis of cancer and can't remember anything beyond that point in the conversation because they are consumed by emotion. Or the surrogate decision maker that's visibly fuming in the family meeting and the medical team can't get them to talk about a plan because they're consumed by anger. Or sometimes it's much more subtle, presenting as silence and disengagement as emotion has overtaken somebody. Or sometimes it can be seen in the language when we help surrogates use "they want" instead of "I want." And these are all ways of us helping our patients or their families to act more from a sense of duty and reason, helping them to work with the challenge and the reality of emotion. Let's end with something controversial. Do patients have too much autonomy? What about vaccine mandates? What about our choice to end our own lives? The modern understanding of patient autonomy is that patients are individuals who are self-determining, and they get to decide their own values, their own definition of quality of life, the risks they're willing to take, and their goals for their healthcare. And the role for medical experts is to provide patients with expertise and what options are available within some reasonable limitations so that patients can make their own choices about their healthcare. This modern version of autonomy gives quite a bit of freedom to patients. So much freedom that it's pushing boundaries and causing all of us to rethink what are the limits of what patients can ask for. And it's even causing moral distress in some areas of medicine. Kant had a very different perspective of autonomy. Autonomy for Kant limits choice because an autonomous person, according to Kant, was bound by their duty to act morally and do the right thing, not just for themselves. In a Kantian world, no patient would ask for treatment that's not medically indicated or overly risky, and a physician would equally have a duty not to offer such risk to their patient. I think this Kantian version of autonomy is more appetizing in some ways to some of us in healthcare. And this topic of duty versus personal freedom is very topical to the issues of our time. I share these next two examples to challenge you to think differently. I'm not trying to change your mind that Kant has this correct. All I want to do is show you a very different way to think about these modern issues and just broaden your possibilities. So, how would Kant, if he were here today, how would he advise us to act during COVID? Now, you could pause here and sort of challenge yourself to answer this with what we've learned so far. First, there would be no vaccine or mask or any other mandates in a Kantian world, because even if those mandates were put into place for the most virtuous of reason, such as public health, it would still take away autonomy and treat the population as a means and not an end. Remember, Kant believed that there was never an exception to the categorical imperatives. No matter how much greater good can be argued, you can't break the rule of using someone towards a goal, even a virtuous goal. However, mandates, I really believe, would be irrelevant in a Kantian world because the population would act from an obligation of duty towards public health during a pandemic instead of from a place of personal freedom of choice. And so, with little exception, everyone would be vaccinated and everyone would adhere to whatever CDC guidance was in order to help our fellow mankind. Kant's perspective on physician-assisted suicide also challenges the way we think about modern ethics. He's going to approach this from reason and offer an explanation of why physician-assisted suicide is illogical, instead of thinking about this how we tend to think about this now, which is more within the concepts of suffering and emotion and quality of life and goals and freedoms and control and choice. So Kant does this by arguing that physician-assisted suicide violates all of his categorical imperatives. And I want to leave you with 3 powerful passages where Kant outlines his rationale. And I am not going to read this to you. I recommend pausing here, reading these, wrestling with these for a few minutes. It'll be worth your time to open yourself up to something different. Thanks for listening. I hope I was able to introduce you to something new. I hope this left you challenged, and challenged in a good way. I hope this left you more curious about Immanuel Kant. I hope I was able to put into perspective some of the Kantian principles that you've seen, maybe you even share, and now better understand where it is that they come from. I'll see you out there on the wards.